Hello, welcome to this week's episode of What the Health. I'm Janelle Thompson, your family nurse practitioner here at the Hawkeye Student Health Clinic. So this week we're going to be talking about nasal congestion, stuffy noses. This is one of the leading causes or attributes to the causes of people coming to the Student Health Clinic for visits at this time of year. Nasal congestion and stuffiness can be caused by a number of influences. This can be caused by allergies, virus, bacteria, fungus, foods we eat, and beverages that we consume, spices, emotions, lack of humidity in the air in our surroundings, pregnancy, and injuries or structural deformities to our nose. Let's go ahead and start off our discussion by learning a little bit more about the anatomy of the inside of our nose. So your nose from the front to the back really is about 5 inches long, and the inside is about 3 inches tall. So there's a lot of space in there. It's divided in half in the front by what's called your nasal septum. That's a bone and cartilage divider. Now, I want to point out that when you get all the way to the back, the septum doesn't go back and divide it in two all the way back. It actually opens into a big space in the back that is called the posterior nasopharynx. Your sinuses each have an opening from the inside of the nose that allows air and mucus to pass back and forth. When we look at the nose from the side profile, we have what are called air warmers, and there are generally 3 sets in everybody. They are finger-like projections. Their purpose is to warm and humidify the air that we breathe in, and they also create mucus. The normal adult nose makes about a quart jar of mucus in 24 hours. And so think about the mayonnaise jar that's in your refrigerator or your mom's refrigerator at home. That's a lot of nose mucus. So how might your congested or stuffy nose be evaluated? Well, a detailed history gives a lot of information as to what's going on. When did your nose congestion start? Was there an injury to your nose? Are there any associated symptoms, such as are you running a fever? Are you having itchy, watery eyes? Are you sneezing a lot? Are you having pain in the areas of your face that are your sinuses? Has this ever happened to you this time of year in other years? Is there a family history of this sort of problem? And then also, what treatments have you tried so far, and did they help? Listening to your history, understanding about your symptoms, and then looking at the findings that are seen on your exam will really bring us to the conclusion of what most likely is causing your symptoms. There are some things that you can do that are just over the counter that are worth giving a try, and oftentimes are very successful. So first off, we talked about a dry nose, just simply having a nice humidifier. This is a nasal saline rinse kit. This is another form that it can come in, simply saline. By cleaning your nose, you're actually removing some of that debris, and if it's a virus, a bacteria, or a fungus, then it has less contact time so that it can continue to replicate, so you can help to prevent colds by doing that. So when you do rinse with saline solution, it also takes that stuffiness from swelling out of our tissues. Nasal steroid spray. So nasal steroid sprays, this is an example of Flonase. They work by landing on the tissues in our nose, binding to the top of the tissues, getting absorbed to create a steroid effect that actually brings inflammation down. Afrin nasal spray. This works amazing to open up the nasal passages. The downside of this, if you read the print on the back, it would say, do not use for more than 3 days. So what happens after 3 days? Your nose gets addicted to it. The only way to get off this spray, if you use it longer than 3 days, is just to cut it off cold turkey. Claritin, Zyrtec, these are both types of non-sedating antihistamines. This is meant to be taken once a day, and it can provide relief of some nasal congestion, but not as effective as topicals. It does a pretty good job though. So that concludes our topic today of stuffy noses and nasal congestion. If you feel that you'd like to be evaluated at the Student Health Clinic to talk about this further, please just give me a call and we'll set you up for an appointment.